Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I'm going to talk about my skincare routine and the treatments that I do for my skin and hair and nails to take care of myself. This comes up a lot. Patients are always asking me, what do I do? And I think that it's best if I do it in a podcast because when people come into the office, I want to be spending my time on their issues and not what I do. So here it goes for what I do. We'll start with my face. I wash with cool water, Dove fragrance-free soap bar with gentle cleansing with my fingertips twice a day in the sink, once in the morning, once at night. I've been using that very non-irritating soap forever. I do think they changed the formulation of it, but I still like it, and that's what I use. To moisturize, I use from my office either the ultralight or the oil-free, both of which are oil-free. And I use sunblock. My favorite in the morning is the Color Science. I like the Color Science tinted sunblock. It looks like a bit of light makeup, but it's very lightly tinted, so it's not too heavy, and it's a fantastic sunblock. And in the evening, I either use just plain moisturizer or I put on azelaic acid, which is one of my favorites because I have a little bit of mild rosacea. Or I will put on tretinoin cream, the one from our office, either the 0.025% or the 0.05%. If I'm putting on the tretinoin, I typically try to wait 20 to 30 minutes between washing my face. I will then moisturize. I will wait a while and then put on the tretinoin, which is what I advise for most patients anyway. If I don't do that, it gets too irritating and I get really flaky. When I'm out and about throughout the day, I reapply my sunblock, either Color Science or some other sample tubes that I have in my pocketbook. And if I'm going to be in the sun, I always wear hats and sunglasses. So no sun ever touches my face for any reason ever. I will wear a hat from the car to the supermarket, or if I'm out and about in a city, I will wear a hat. I'll carry it with me. And I always try to be in the shade if I can. Specifically for my under eye area, I have used for years our branded eye cream in the morning and our eye serum at night. I remove my eye makeup with Vaseline petroleum jelly and like a soft tissue paper wipe. I always wear sunglasses to prevent the ultraviolet damage to my actual eyes, but also to prevent me from needing to squint, which causes wrinkles. So the eyes are pretty simple. For my neck, I use our retinol smoothing cream at night. I'll occasionally swap that out for the tretinoin or generic Retin-A, and I will use the Neotherapy peptide cream in the morning and, of course, sunblock if I'm going to be out and about. And that includes driving because of the UVA rays that come right through the car window and age the skin. So on my body, the sunblock I use many different types depending on what's around, but my favorite is the Elta MD UV Sheer, which is very light feeling and not greasy and has zinc in it. I always use zinc-based sunblocks. I also like the Elta MD Zinc Spray, and I also like the Vanny Cream SPF 30 Moisturizing Sunblock. But really anything that is a 30 or above with zinc, if I have it, that is what I'll use, but those are my favorites. For my body, all I do is wash with the Dove in the shower. I'm not a big scrubber. The skin doesn't need a lot of scrubbing. I tell this to patients all the time. I use the soap where I need it. But when I get out of the shower, I'm always moisturizing every single day. I don't think I really ever miss that. My favorite is the Vanny Cream Moisture Skincare Cream. It's fragrance-free. I'm allergic to fragrance, and it sinks in nicely. It's not that greasy, but it's a strong moisturizer. There are so many different brands, and I will often be trying things because I'm always sent products to try. And I will use other things, but my baseline is the Vanny Cream. For my hands, I like to use either Elon nail conditioner for the fingertips or a thick emollient like Cetaphil ointment or Vaseline petroleum jelly or Aquaphor, and I will do that morning and night. If I need more moisturizer as the day goes on, I will periodically reapply, usually something thick like I just mentioned, particularly in the winter, or I will also use, we have a really nice hand cream that's a little bit lighter. in our office. I do not ever go to the nail salon for my nails. It's just not my thing. I work with my hands. I'm washing them. I'm using hand sanitizer. Manicures just don't last on me. And I've just seen too many of the problems with manicures and pedicures, so I just don't do manicures and pedicures, and I just don't have the interest. So that's not part of my routine. Oh, I almost forgot the lips. The lips is very simple. I use our Mint lip balm that has the SPF in it, and I use it multiple times a day. I keep one in my pocketbook. I keep one by my bedside. I keep one in the kitchen. I keep one everywhere in my house, at my desk, at my office. I put it on many times a day, and that is what I use for my lips, and I've been doing that for many, many years. For my hair, I rotate shampoos as I do have mild seborrheic dermatitis, otherwise known as dandruff. My favorite by far is the Jupiter shampoo and conditioner that we have in our office. And I rotate that with whatever else is lying around. I wash my hair probably 2 to 3 times a week or so, and the other days I just rinse with water and condition it. I used to wash my hair every day, but as I've gotten older, my hair is much drier, and I have reduced the washing and increased the conditioning, and it's been helping me. So that's my skincare routine. For my skin, my hair, my nails, I keep it pretty simple. Now, everybody always wants to know what treatments I do because we offer lots of different treatments in our office. And I want people to know that if we offer it in our office, I have tried almost everything, as we always want to make sure that we know what our patients are experiencing. So me and my staff usually try everything as much as we can. But what I do on a regular basis is I do Botox every 3 months. I've been doing this since my mid-30s. I inject my entire face, including my forehead, my glabella, which is between the eyebrows, my crow's feet. I do my under eye. I do my bunny lines on the top of my nose. I do a tiny bit into my upper lip, and I also do my chin. I also do my entire neck. So a lot of Botox, and I do it every 3 months, very consistently. I also do filler once a year or so to my nasolabial folds, the corners of my mouth, and my chin area. I've had Juvederm, Restylane, and RHAs. They're all good quality products, and that is what I do for fillers. In terms of treatments, I do photofacials, which are intense pulse light, and I did my initial series of 5 in a row, and then I've been doing them every 3 months, and it's been many years. This helps reduce any redness, which I get because I have mild rosacea, and it's also great for my anti-aging and stimulating collagen growth. Another way I do anti-aging and collagen growth is I get Ultherapy treatments done. And these are done in our office. It's a deep ultrasound treatment, and I do both the full version, which is tightening, and I do my jawline and my underchin, and I do that once or twice a year. And I also do it as what we call the collagen boost, which is a lower level on the entire face. And I also do that once a year. And I will say, yeah, it hurts. If you are interested in hearing more about Botox, fillers, photofacials, or Ultherapy, please scroll back and find those podcasts to listen to. If you want to hear about a basic, no-nonsense anti-aging skincare program that you can figure out on your own, I have a podcast already released on that subject as well. But if you need or want specific advice for what you should do for your skin and your particular issues, please call and book a consultation with me or another board-certified dermatologist. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.